Greetings. I would like to share a brief introduction to Reiki and how it can be a beneficial complement in a holistic approach to palliative care in a hospice setting. First, I'd like to introduce myself. My name is Karen Riviere, and I am grateful for this opportunity to share Reiki with you. Reiki has been an integral part of my own healing journey the last 7 years through being widowed twice, parenting my teenagers, and through my now 4 year experience with long haul COVID. As a Reiki master, teacher, and practitioner, I offer private sessions, attunement classes, continuing education workshops, coaching, and also Reiki Share community events. Reiki is a very mainstream healing modality. It's even offered in many hospitals around the world. People combine Reiki with what they already do, like hairdressers, massage therapists, nurses, all sorts of healing professions, even parents. With that being said, the average person generally has no idea what Reiki is or how it can benefit them. So let's start there. What is Reiki? Simply, it's an energetic, hands on healing modality that originated in Japan over 100 years ago. Reiki is heart centered, gentle, simple, and safe. It works to heal, harmonize, and balance a person on all levels of body, mind, and spirit. So, how does Reiki work? Like all energy, Reiki works on an energetic entrainment principle, much like a tuning fork. The practitioner channels in and offers a high frequency of universal life force energy. You can call this Source, God, Holy Spirit, Universe, or just simply love. This frequency is offered as a gift to the recipient so their body, mind, and spirit can be entrained to this higher vibration. It's up to the person to receive this energy and use it how they want to the level they're ready. Sometimes people aren't ready to heal, either on a conscious or a subconscious level. But to the level they're ready to heal, lower vibration energies like stress, negative emotions, and even physical pain can be released, balanced, and harmonized. Reiki is proven to promote relaxation and reduce stress. Studies show Reiki works with the biofield of the body, helping the physical body get into the parasympathetic nervous system. A Yale study showed it can improve heart rate variability. I found a February 2017 article in the Journal of Pain and Symptom Management that discussed research of Reiki and palliative care hospice settings. It noted some symptoms were relieved by Reiki, with the most common being anxiety. Others included pain, agitation, nausea, and insomnia. There were no reported side effects. Reiki does no harm. Reiki is especially useful in facilitating mental and emotional release. This can support the body in reducing pain and even healing itself. So, what happens during a Reiki session? The person lays down, usually on a massage table, or sits in a chair if they prefer. In the case of palliative care, I invite them to be however is the most comfortable for them. I can work around just about anything, whether that's in a wheelchair or even in a bed. The recipient stays fully clothed except for shoes. They're welcome to bundle up in a blanket if they want. Before the session, I always ask if there are any areas of the body that they want to focus on, or if there are any areas of the body that should be avoided. Before the session, we set an intention. I generally ask things like, how would you like to feel? Or what would you like to work on releasing? Or what would healing or balance look like for you? I hold that intention and offer that frequency as I work. For example, if someone is stressed, I hold the intention for and offer the frequency of peace. During the session, the recipient is invited to relax, to focus on their intention and breath while noticing what's being felt in their body. A session generally lasts 45 to 60 minutes. While I place the hands on the body, head to toe, front and back of the body if possible, always avoiding private and sensitive areas. while offering Reiki energy. While I believe physical touch can be immensely healing and comforting, Reiki can be done hands off if the recipient prefers. Reiki can also be done long distance, meaning the practitioner and the recipient can be across the room or even in a different location. So, what might a person feel during a session? Some people might actually be sensitive enough to actually feel the energy moving in their bodies. This might feel like heat, cold, tingling, buzzing, pulsations, numbness, and the like. Or they might see colors or get visual images. They might feel emotions as stuck energies are released and balanced. Rarely are these sensations uncomfortable, and they generally pass quickly. Sometimes a person feels nothing at all, but just know the energy is flowing and working whether they can sense it or not. What happens after a Reiki session? After a Reiki session, the energy continues to work in the physical, mental, and emotional bodies for the next day or two. Sometimes a range of physical energy levels, sensations, or emotions can surface. This can be a normal part of the integration and healing process. It's just energy moving in the body seeking balance. It's something to notice and allow. If these symptoms are even felt at all, they're a form of detox and subside within a few days. Drinking slightly more water than usual can help. If possible, take some time after the session for quiet reflection and energy integration. This would be a good time for art therapy or journaling. Maybe consider getting outdoors in nature for a bit. Bonus if that can be barefoot on the earth. So, can Reiki cure someone of disease? There's an important difference between healing and a cure. We all desire the cure, a return to that state of being before it happened, the diagnosis, the injury, the heartbreak. However, that's not the goal of Reiki. While Reiki can support such miracles, its goal is healing. Healing is achieving a new balance and wholeness with what exists now, a new homeostasis. We all have our stuff, all the mental or emotional baggage someone's been holding on to, sometimes for a long time, even as far back as childhood. A Reiki session is an opportunity to let go of thoughts, beliefs, or emotions that are stuck in the energy bodies. These can be connected to things like traumas, addictions, physical possessions, the illness being experienced, current or past relationships with themselves, friends, or family. For a hospice patient, this stuff can keep a person tethered to the physical body here on earth and make the natural transition to spirit more difficult or lengthy. Reiki can support a person in letting go of what they've been holding on to, transmuting these thoughts, emotions, or attachments to balance in a gentle, harmonious way. Courage, acceptance, and peace can replace guilt, grief, and fear. A Reiki session can help bring someone to a place of closure, a place of healing. This can support them in transitioning out of the body with less fear, more love, ease, and grace. Reiki is about bringing about a sense of releasing what was and embracing peace or acceptance with what exists now. A new harmony and balance can be found within the current life experience. When this mental and emotional healing happens, perception of pain in the physical body can even lessen. So, how often should someone get a Reiki session? Everyone's healing journey is unique. I encourage clients to listen to their bodies to know when they're ready for another session. In general, for acute symptoms, consider a weekly session. For ongoing support, consider monthly sessions. A person can only heal to the level they're ready to heal at any given time for their highest and best good. Healing can be a journey of spiraling back on the same things, releasing another layer each time. So, why would you want to include Reiki in your palliative care plan? Here's where I would like to share a little bit of my own personal experience. I was the primary caregiver for the love of my life as he transitioned from cancer over 9 months. 5 days before he passed, I was gratefully able to take him home from the hospital. Because he still wanted to pursue a cure despite the odds, we were disqualified from hospice support. We had arranged home health that was supposed to make weekly home visits for wound care and medical support. So I was it, 24/7 caregiver, literally. Cleaned up the constant vomiting, changed and washed the sheets, managed his TPN IV, kept track of all the meds, monitored his vitals, keep, keeping the oxygen cannula on his face, pulling him up in the bed because he was constantly sliding down. You get the idea. All the things a caregiver or a nurse would do to support his physical body. I was so overwhelmed just taking care of all the things that needed to be done to physically support him. And since we'd been in the hospital for 2 months and I hadn't been home, I was also trying to get myself settled back home and take care of my 2 kids who had missed their mom. I had no time or energy left over to adequately take care of what was really most important, his mind and spirit. It's my greatest regret and grief that I was unable to just stop the frantic pace of caregiving tasks for the physical body in those 5 days until the last minutes, to just be with him, to hold space, to sit and hold his hand, to hold his heart. This is why I believe adding Reiki to the palliative care team in a hospice setting is so very valuable. Beyond the benefits of Reiki we've talked about so far, I can be the one person who has no other responsibility other than to hold a safe space for the person, to be fully present, to witness what they're experiencing without judgment or attachment to the outcome. I can see and validate them in that moment, exactly where they are on all levels: physical, mental, emotional, and even spiritual, while I offer the healing vibration of love, of Reiki, for them to use in whatever way is best for them that day. Of course, everyone on the care team and their family or friend caregivers supports the person with love, but they necessarily have to split their attention doing all of the things that they are responsible for. The Reiki session is a time for the person to just be, to be held in a bubble of love while I offer healing Reiki energy. You may wonder, does Reiki impact other medical protocols? No, absolutely not. Reiki does not interfere with or replace the support being received by medical professionals, medications, or other procedures. Reiki is not meant to take the place of treatments by a person's medical professionals in any way. It's intended to complement appropriate allopathic care by supporting the mental, emotional, and spiritual bodies of the recipient. I do not diagnose, prescribe, or treat for any condition. Recipients accept responsibility for their own health care and maintenance. With that being said, Reiki can be a beautiful, synergistic piece of a holistic approach to seeing and caring for a person and the totality of who and what they are: body, mind, and spirit. We are not just our bodies. I hope this has helped you better understand Reiki and its potential value as part of a palliative care team. I welcome the opportunity to serve alongside you, supporting you, your patients, and their caregivers. and oneness and gratitude, I thank you.